Righto, so happy to take any questions. Look, this is a policy that is too risky right now. New Zealand cannot afford a Melbourne-style managed isolation program that sees the virus spread into the community. We know that COVID is growing, not slowing around the world. We're seeing more and more cases arrive into our managed isolation facilities with returnees. Our priority as a Labour Party is to make sure that we're keeping New Zealand safe.
Do you think any of the elements of it will be beneficial for New Zealand moving forward, such as the Bluetooth tracking?
Oh, look, there's a number of measures that are already underway, that the government already has underway. We've already announced that we'll be trialling the COVID card in a managed isolation facility. We've begun the work on starting that trial. We've also talked about enhanced security systems that we're putting into our managed isolation system facilities that we've already done a trial on in one of the systems and are now rolling out into further facilities. The issues around having a booking system for managed isolation, we're currently testing a system. That's work that's been underway for weeks. And that people will be able to use that in the coming weeks. Yeah.
Sorry, Megan. Half your face is on the light.
Do you want me to?
No, just go back a wee bit.
Okay, there we go.
Yeah,
there we
perfect.
Go. There we go.
Sorry, me.
No, all good.
Just see you half and half.
Okay, there we go. Yeah.
Can I ask you, please, should we allow shorter stays in isolation for people from COVID-free or COVID-safe countries?
Well, look, one of the issues that we've always worked through when this has been discussed is actually a large number of the returnees arrive in New Zealand on flights where there are transit passengers from other countries. They're transiting through Australia, so that they are on flights that have come from more risky countries. But look, what we have always said is this is a system that will evolve. If we can get to a position where we can do that, we will. But this is a measure that is too risky right now, and we are not willing to put New Zealanders at risk.
What do you think about private accommodation suppliers being able to charge what they want?
Look, in terms of the what it takes to run a managed isolation facility, we currently have 32 facilities across the country. There are 4,000 staff working across those 32 facilities. We have the New Zealand Defence Force, we have the New Zealand Police, we have our public health professionals involved in the provision of these facilities. They are complex operations. We want to ensure that these are watertight and are keeping New Zealanders safe. It is too risky to be thinking about facilities that doesn't have those provisions in place. But one thing I will say is that we have seen the National Party being high risk takers with our border all through COVID, that we had discussions about opening up bubbles with Australia and China, which we considered were premature. We've had back and forth on what provisions they want at the border, and this just does not square with Judith Collins' vow to keep COVID out. This is putting New Zealanders at risk.
There is more capacity to have people in managed isolation, so why are we not using it?
Oh, look, you will have seen an announcement today, two announcements by the Minister of Immigration, Chris Farfoy, that talked about that is the result of work that we've been doing with a number of industries that need to bring in non-residents and non-citizens for economic benefit to New Zealand. We've announced today that we are bringing in a cohort of people to work in our fishing industry, in our agricultural sector, and across events. And also the Labour Party has said that what we want to do is actually have a proportion of our managed isolation facilities that are for economic entries, people we know that are required to get New Zealand moving.
Why not spread quarantine facilities even more around the country so that Auckland's less at risk?
So we do have 4 centres, or 5 centres, where we have managed isolation facilities. That we have a number of facilities in Auckland, but we also have facilities here in Christchurch. We have facilities in Rotorua, we have facilities in Hamilton, and we have facilities in Wellington. We have also looked at other parts of the country, and what I think that it comes back to the complexity of these operations, that it's not just about having beds and facilities, it's about also having all the other wraparound services that need to be put in place to make sure that New Zealanders can be kept safe.
So essentially, is it too
Oh look, we have 6 facilities here in Christchurch, so that we do have spread. There is a predominance in Auckland, that is where the international flights are arriving into. Every movement of people obviously requires another risk-based approach for setting up chartered air bridges to get people to other places, but we are doing that. And that what we are doing is and have been doing is putting in place a system that protects New Zealanders, that we are determined to keep COVID at the border. And at the moment, the way in which we are doing it is the way we are succeeding. We have had 50,000 people through our managed isolation facilities since March. That is a large number of people.
Do you support the idea of testing people after they've already been in quarantine?
So quarantine rather than isolation. So of course everyone who has completed only gets released from isolation after 14 days if they've completed a test, a negative day 12 test. In terms of quarantine, that's more complex, because what we do know is that people who have previously had COVID, and to be in quarantine, you have had COVID, that people have been testing positive for COVID up to 102 days after they've already recovered from the virus and are no longer contagious or no longer sick themselves. So that there have to be a more complex set of measures to determine whether someone can be released from quarantine, and that is something that health very much are in charge of, because this is a health-based approach which is ensuring that we are keeping New Zealanders safe.
Minister, on Southern Response, can you explain why the government decided not to appeal the decision?
Look, we made the decision to initially take the case to the next to the stage that it's currently just been through, because there were some questions of law that we wanted clarity on. The minister responsible my fellow minister responsible for Southern Response and I met with the Dodds prior to us making that decision and explained why we were taking the appeal that we did, and that was to clarify those points of law. Those points of law have now been clarified, and we want the Dodds to be able to get on with their lives and move on to the next phase.
Their lawyer estimates that it will cost the government $500 million in order to pay out the other respondents. What is the cost that the government has come up with?
Look, that is a matter that is currently before the courts, so it's not one I can comment on.
Do you have a rough idea?
That's a matter that's currently before the courts, so it's not one that I can comment on.
If you're still in government, how committed are you to getting, obviously the Dodds are one example, but the estimated 3,000 remaining cases resolved?
Look, as I said, that's a matter before the courts, and it's not one that I can comment a great deal more on. It's also, we're in a pre-election period, that it would also be inappropriate to comment on that from that perspective.
Remaining cases, you will make them go through the court system?
Oh, look, it's a matter before the court, and I'm just not prepared to say anything more at this stage.
There have been calls for an inquiry into Southern Response. Should this happen? If so, why?
Well, look, one of the reasons that we undertook an inquiry into EQC, we promised it before the last election and we delivered on it. Dame Sylvia's excellent report into EQC is, of course, that EQC is an enduring entity. That it's not a case of if, but a case of when EQC will be called on by New Zealanders again. And we certainly never wanted another group of New Zealanders to endure what we've endured here in Canterbury. Southern Response is slightly different, of course, in that once these earthquake claims are paid out, it will no longer exist.
Why did you feel the need to call the Dodds this morning and apologise?
Look, that wasn't the first conversation that I've had with the Dodds. As I said, that Minister Robertson and I met with them several months ago now to explain why it was that we were taking the case to the next stage. I called them because I think it was the right thing to do. There's a couple that have had a very difficult period of time, and I wanted to tell them myself the decision. I just certainly didn't want them to hear it through the media, and I wanted to say that I was just so pleased that they could now get on with the next phase of their life.
Do you think the government understands what people, especially in situations like the Dodds, have been through over the last 10 years?
Look, I can assure you that my colleagues are well aware of how difficult things have been here in Christchurch for people as we have battled through insurance issues. One of the reasons they're so aware of what a mess we were left to clean up by the previous national government when it comes to insurance is the number of times I've had to go to Cabinet and ask for funding to clean up those messes. I can point to the on-sold issue, I can point to the continual need to keep funding the re-repairs from the botched botched repairs that were initially carried out. So I think my colleagues have a good appreciation. They went into government from being in opposition, knowing how difficult it was for people here in Christchurch.
But what's your advice to the other claimants? Because obviously the Dodds have gone through the court case and this has kind of set a precedent. So what should other people that are currently in that same position do now?
Look, as I said, that is a case that is currently before the court, so I can't comment any further.
Did you offer an apology to the Dodds?
Yes, I did. Reiterated what we told them when we met with them several months ago, that we were very sorry for what they had been put through and the very difficult period of time where they just haven't been able to get on with their lives.
Have you heard from or talked to any other claimants in this situation?
In terms of the class action, I could well have, in my course of being an electorate MP, that over the last 9 years that I've been the Member of Parliament for Wigram, I have met with so many people that have been caught in insurance messes. So that talking to claimants is something that is part and parcel of being an electorate MP in Christchurch and still is.
What are the things you're hearing on the ground from them as, it's been 10 years and they're still not?
Oh, look, I mean, I think for some people it's a frustration that they've had a failed repair in terms of the vast number of re-repairs that have had to have been undertaken, that people thought that, that they'd got their house fixed and they'd moved on. So that's certainly something that I hear. The other frustration that I heard very early on when I became the minister responsible was the mess that we were left in the issue in terms of the on-sold issue, and what a difficult situation that was, and why our government made a decision that we needed to do right by those people.
If you stay in government, what do you plan to do going forward on this?
Well, one of the things that I think we've seen great success in terms of working our way through and unpicking the insurance mess here in Christchurch has been the Greater Christchurch Claims Resolution Service, that we have managed to settle a number of very complex claims through that organisation. It not only has legal advice for people, but also engineering, but also some support to get them through. I mean, it's a decade on. The other important piece of the puzzle in terms of getting claims settled, of course, has been the existence of the tribunal, the insurance tribunal, so that there is an access to justice for people without having to shell out many, many thousands of dollars.
Can I just come back to isolation, please? Those who are paying for or who are charged for isolation, should they have more options as to where they stay?
Look, I think one of the things that that we looked at very carefully was how we balance using capacity with people's ability to choose where they are going to be. You are in isolation, that you're not going out, so in many ways the location is immaterial, that you're in your room largely for 14 days. So in terms of which part of the country you're in, that is largely immaterial. We will have our managed isolation allocation system stood up in the coming weeks. At this stage, that won't be allowing people to book a hotel, as it were, but what it will do is allow us to manage the flow of people and make sure we're maximising the capacity, the ability to bring New Zealanders home, but also bring in some of the arrivees that we need for our economic recovery is something that we want to ensure that we are maximising.
And what about the idea of, say, staying in a luxury lodge as managed isolation?
Look, in terms of what the future may hold, these are not things these are things we're not ruling out. But at the moment, what is needed to keep New Zealanders safe, to ensure that we are keeping COVID at the border, is that we do have these complex operations which have the New Zealand Defence Force involved, that have the police and have public health professionals. But this is a system that continues to evolve. But at the moment, that the safest way for New Zealanders is through the managed isolation facilities that we are operating. And I'd like to point out that there is the ability for up to 14,000 New Zealanders each month, or arrivees, to return through those facilities each month.
Just got two more questions, if I may, on emergency housing. Is it called a charge our most vulnerable to stay in emergency housing?
This is a piece of policy that we looked at very carefully, and certainly was one that when I became the Minister of Housing, which the Associate Minister of Housing, Chris Farfui, and I spoke about at length, and also with the Minister for Social Development, Carmel Sepuloni. that it was of course meant to come in earlier this year but was delayed because of COVID. But one of the things that we do find that we have an anomaly between systems. There are some people that pay for staying in a motel, and some people that don't, depending on the system that they've gone in. The advice that we got, which actually I found compelling, was actually what we need to be doing is taking an approach with people where we are readying them to move out of emergency accommodation and getting them into a position where they can pay rent. And so that we are putting those wraparound supports around people while they are in emergency accommodation, and making sure that they are ready to move beyond emergency housing, because that is ultimately our aim.
Thank you. Just lastly, should people be charged at the same rate, which is 25% for emergency accommodation and state housing, when the standards are clearly different?
So it's 25% of their income. It's an income-related rent. It's not 25% of the cost of the accommodation, which I think is important to realise. That of course we want temporary and emergency housing to be just that it is a stepping stone to getting people into more permanent housing, and it's why as a government we have invested heavily in transitional housing and of course in our public house build.